Hello and welcome to PM Express with a twist, spotlighting little angels, I call it. My name is Nana Ansakwa IV, and today we're just identifying people who in their small way are doing big things and impacting a larger society. There's so many of you out there doing great things but don't get the opportunity to air it out, and that's what we're doing today. We're talking to two wonderful ladies who are doing fabulous. One is doing something in health, the other doing something in education. How did they start? What are they doing? Stay tuned and watch it and be encouraged, because I'm sure within your community there is something that you can do to help. Don't go. Thank you very much for staying. As I said in my intro, well, today I'm talking to two wonderful Ghanaians who in their own small way are doing something very big. Indeed, there are many Ghanaians who maybe are doing this, but we don't pay too much attention to them. And so today I thought, well, you know what, let me put my lenses on them and highlight what they do. You know what, it may inspire somebody, may get somebody to even volunteer with what they do, or get somebody to start that, because there's no equity in this world. This world is designed that those who have 10 should give 5 to those who have none. Those who even have none should go and help somebody, you know. So at every given time, somebody should be helping somebody. And these wonderful ladies are helping someone. With me is Kathy Eka, who is from the African Health Now. And thank you, Kathy, anyway.
Thank you for having me here.
Good, agreeing to talk to me. Kathy, you're a banker.
Yes.
And so anytime they said, oh, you know, somebody's doing something in NGO, I'm thinking you'll be doing like, you know, credit union for little market corporation thing. But no, but you're more into health.
Yes.
May I ask, like you know, I'm a DJ that was never happened to be, you know. Are you a doctor that was not to be?
No, science wasn't my forte, but you know the saying that goes, health is wealth.
Yeah.
And so you can't be wealthy if you're not alive and if you're not healthy. So when it comes to healthcare, for me, is the primary motivation for what we're doing, giving back to people so that they understand how to take care of their health. So banking is what I do 9 to 5, but anywhere I can volunteer or help out when it comes to healthcare, you'll find me there.
Wonderful. But did you always want to be a banker?
I always wanted to help people, so that has always been the core foundation. And you think as you're growing and learning and picking subjects, the finance aspect came easily, economics and banking. So I fell into finance, and I've been there ever since. And you think of
you fell into it. What was the plan? The
plan was to travel the world and just help people and relax. That was the main thing, to have fun and to meet new people. That's always been, through all the, you know, the studies and everything, it's always been, what can I do to be around people and interact and learn new languages and new cultures. So that was the guiding force. And then you're picking your subject and you're trying to figure out, what am I good at? What comes easy? And economics and banking and finance came easy, and said, you can't, there's no real job where you travel and just meet people, but there's a job in banking where you can still meet people and work and help them. So that's how I got into banking. Great.
But African Health Now, so, well, I know it's something to do with health,
yes.
But which area and how do you go about your things?
Okay. So I could give a little preface. The founder is Nana Aisen Akiwowo, and she's in New York, and her father suffered a stroke a few years back, and when you're thinking of how to provide healthcare, immediate healthcare to somebody back in Africa, she had a bit of a challenge and a struggle. And so we noticed that there was a big gap in healthcare provision in Ghana, especially in the rural areas. And so that's what inspired her to start this NGO called African Health Now. And the name is self-explanatory, providing healthcare and providing it now, and providing it to the African continent, which is where we're all from. So that's where African Health Now came from. And she got her friends involved and said, hey guys, I need your expertise. I need you to help me deliver on this. And so we're all in our different capacities helping on the board. So I take charge of the finance and some of the planning and treasury aspect because that's my career backing. And right now I'm the only board member in Accra. So I also represent all of them in terms of decision making and on the ground support because I'm here full time now.
So how do you pick the areas where you have to help?
We noticed that the most marginalized are typically the women and children. And where do you find women and children? Mostly in the markets. So most of our health fairs have been in the markets, Mamprobi, Agbogboshi, Tema Station Market, Medina Market. So those have been our focuses. We go to the market, we help the women. Once you empower a woman, you've empowered a household. Yeah. So that motto has kind of guided us in selection of our health fair sites.
Response-wise, what's been the response once you get to the market and get to these places?
The response has always been overwhelming for the support we come to give. They're always excited that people are thinking of them and wanting to help them. So we ask for help on, you know, the location, where to place our equipment, where to plug in for power supply, and they're always willing to help us. The market women, typically we're led by a market queen that will facilitate everything for us. There's never been an occasion when we've been turned down. So the support has always been enormous in getting ourselves set up for these health fairs.
The other thing I wanted to find out was you're not, you're not a doctor. You're not in the medical field. Everybody else is, outside. But then, if you're going to go to these areas, then you need doctors. I wonder if you have a team of doctors, or if you have volunteer doctors who would come along. And is it primarily just women and children, or men are also added? But let's look with the doctor side first.
Yes. So, yes, I'm not a healthcare professional, but there's, in providing a health fair, there's a lot of ancillary support that goes along with that. So, logistics, supplies, and other things that we all can do. So you don't necessarily have to be in the healthcare field to be able to assist. For our healthcare professionals, we do use a lot of nurses and doctors. Our hope really is to get a stronger and larger core group of Ghanaian medical professionals. So that's our doctors and nurses to come from Ghana and to be working in the Ghanaian communities to help us. Right now we do work with a core volunteer group of nurses from the 37 Military Hospital. We also have a couple of doctors that work in Medina as well as Spando that are on our rotation basis. But most of the healthcare professionals we've brought in the past have been from New York and from outside who want to give back to the community. So our hope is to really grow our network of doctor volunteers and nurse volunteers.
Now, are these the volunteers in Ghana? Are they volunteers, or look, you have to pay me to come?
No. So that's one thing that's a bit different in our culture is that, like you said, a lot of people are expecting a payback, what's in it for me? But one of our core things is to build a camaraderie amongst our volunteers. So we're all doing this on our own free time without expecting pay. And so you get a few that really understand what volunteerism is, and they introduce you to their friends who are like-minded, who come and help once or twice. And then that's how we've grown our core volunteers. So no, our volunteers don't get paid. They get paid by seeing the impact they've created in the communities, the thank yous from the people we've served, and just the bond that we have. And you'll be surprised when we don't have a health fair planned, we're all connected. When some of our volunteers get married, we go and support. When there's an outdoor, we go and support. So we've created sort of a family, an African Health Now family. And it's not just about what's in it for me, it's about the family, the bond, and then giving back. We do not only serve women and children. Our health fairs are open, so you do find men in the area that come. But our main focus is really women and children, and from there on, it goes to the families as well. So no one is turned away at our health fairs.
Do you do more than the usual, come and check your BP and come and check your pulse and thank you very much, bye-bye, or you do a bit more than that?
Yes. So that is the initial way to start a conversation with somebody about their healthcare. So let's find out where your blood pressure is. Let's find out where your sugar levels are. What else is wrong with you? So conversations go beyond the simple screenings. We provide one-on-one sessions with a doctor that they typically wouldn't have. And also when it comes to basic prescriptions, we provide them at our health fairs. The last health fair in Bando, we were able to supply, blood pressure medication, some diabetes medication, and give referrals to the local hospitals so that they can go. But we have struggled with follow-ups and follow-throughs. We tried to contact them to get them back to come for extra follow-ups and checkups, and it's been a struggle to get people coming back. There's a fear that what the diagnosis is going to be is bigger than they can handle. But we've taken on the financial burden for a few of our patients that we've taken care of. So, no, it's a bit more than just a basic screening.
So can somebody watching, can they say, look, maybe I come from Nsawam or I come from Dansoman, and look, my community may need a health screening. Can you like apply, say, look, guys, if you guys are free this weekend, I don't know how it works.
Yeah.
Can you pop over to our place?
So we've done this for quite a few years, so it's our expertise. We're good at picking up shop, packing up, and creating a mobile clinic in any area you let us know there's a need. Yes, you can definitely reach out to us and let us know if there's a need in a certain community, and based on logistics, we can come and deliver healthcare. We do a lot of different things to allow people to give back to communities. People can donate even their birthdays. So instead of getting an extra shirt or dinner at the Movenpick, you can have your friends donate to African Health Now, and on your behalf, we will hold a health fair in a community of your choice. So there's various ways for you to donate to African Health Now. There's various ways for you to volunteer, as in come and help out during health fairs, and there's also ways for you to shine a light on an area that needs attention, and if we can do it, why not?
It's not very much our culture. Let's say, you know, a lady or gentleman that's finished university, or somebody who's finished, senior high school, to say, well, since I'm waiting for my exam, why don't I just, sign up to this volunteer and follow them to markets and other places, going to look after people. We're not brought up like that. How do you find, volunteers like that so that you have a good team to move about with?
It is a challenge. It's something you find more outside in the European world, where people are more used to volunteering because they see a big need. So it's an ongoing conversation. People always feel that to volunteer, it takes a lot more than it actually does. And it can be as simple as giving your day, one day, to come and help out, organize the women and children that are going for the test, help with data collection, help with phone calls for follow-ups. So it's something that's creeping up in our society. I like to I don't want to associate too much with the fact that a lot of Africans say that, well, it's not part of our culture, we don't do that. We must acknowledge that we do charity works in different ways that don't look textbook definition. You find that, I'm sure you have relatives in your hometown that you support with school fees, support with medical bills, funeral expenses. So we do it in our culture. It's not the textbook volunteerism. So it's trying to translate that into a way that's more, let's say, in a way that we can account for it, in a way that you're volunteering not to people that you know or are related to, but just a general populace. So it's creeping on and it's catching on, definitely.
Do you have like a timetable to say, look, at least once a month we should do something, or at least twice a month, once every 2 months we must do something? Is there a timetable like that? Or
so typically there's always one health fair a year. Okay. So that's we call it the Gift of Life Fair. We've always typically done it around Christmas, New Year. That is always a must. And then we do ongoings based on the needs, as I said. So we've had people come up and say, well, I was able to raise $5,000 for my birthday. Can you do a health fair? So those are more ad hoc.
I like that.
Yeah,
I
so
like
that's
that.
a sweet thing for people to do. Let us know when your birthday is. And we also support clinics with different needs as well. So let's say we support maternity wards at other places, where we try to find out what their needs are in terms of supplies and logistics, how we can help them. So definitely we're doing different things, different things outside of just providing health fairs.
The prescription one, that's a bit. I've never encountered like an NGO, prescribing drugs.
Yes. So we've worked with dispensers from the local pharmacies that are next to the health fairs. And once we are able to do, you see, not everybody can get a prescription on site.
Sure.
So when, let's say, through the testing, we found out that, okay, we're able to do a rapid, let's say, malaria testing. Sometimes we're able to prescribe, based on the doctor's recommendation, able to prescribe a malaria dose to the person. So that you'll find. Some things are a bit more complex. Let's say, even with blood pressure medication, you can't just prescribe right on the go. So that's where the follow-up comes in. But we've been able to let people walk away with basic medications, ointments for skin rashes, and basic things like that. Yeah.
How fulfilling is that?
Extremely. I can't put a price on it. It is. It's a good feeling to leave a community, and when we pack up our things and get in the buses and they're shouting and waving, thank you. The last health fair we did was in Pando, which is where my parents are originally from, which is what I can call like my hometown. And in terms of meeting with older people and being able to speak the language, and when I was leaving, they were like, thank you so much for coming to our community. Thank you for helping us. I was overwhelmed. So it's a really good feeling, and the people are appreciative, and so you can't put a price on it.
If somebody wants to, I don't know, enroll as a volunteer, you go to a website, you call a number, walk into an office, and what should be the minimum criteria that he or she should be able to have to say, look, this is me, and I want to be part of this, beautiful dream?
So our website is www.africanhealthnow.org, and once you go on there, you can look for ways to help, and it's as simple as that. All you need to have is a willingness to help, and we can definitely put you in the right position to do so. You can help us financially, you can help us with your time, you can help us with introductions to, let's say, people that are willing to give us health supplies, or give us free items for the logistic part of our health fair. So there's various ways you can support. Just definitely check out our website, www.africanhealthnow.org.
What's been your greatest challenge so far?
The fundraising, of course. Getting money is always a challenge. So that's been a big one to go over. But we're so appreciative of our donors back in New York and in the US that continuously support us. So big thank you to them. Another one is really getting our people to come back for the follow-through. Once somebody has been identified as high risk, you can educate them, but you can't really force treatment on them. And what we found is a lot of them are skeptical of, if the bills are too high, African Health Now will not continue helping them out, but that's not the case. So really educating them to understand what we're here for has been a challenge, but every health fair we've noticed that it gets better. The first few health fairs, you call back and they won't be receptive, but now we're getting, we're creating a database of people that we're constantly following up on, and hey mom, the last time we checked, your blood pressure was a bit high and we advised you to do XYZ. I'm glad you went back to the hospital. I'm glad to see that you've taken these lifestyle changes, and we can see the impact on your health. So follow through is a bit of a challenge, but we're getting there. And also contacting our patients, if the phone numbers are not charged, if the phones are disconnected, getting back in touch, because you realize we're doing these health fairs in the market, and it's not necessarily their home, so they're traveling and coming. So getting in touch with them has sometimes been a challenge, but we're working through that, and we've gotten better results as the fairs have gone on. So we're learning from each health fair.
The local clinics, local polyclinics, have they been receptive, or they're thinking too no for no na
No. We found a lot of willingness to partner up with us. Every time we've met with a clinic that needs help, they'll let us know what their challenges are. And most of these clinics are, directly sponsored by, let's say, the Ghana Health Services. So they have links to the government. Things just take a lot longer to get done. So when we're there, we're able to tell them, we're able to do XYZ for you. They're willing, and they'll let us know, okay, this is also not working and this is not working, and we just need one incubator and we just need one extra bed. And so yes, they've been very open to let us know what their needs are, and whenever we make referrals to them, they're very open to following through with the people that visited our health fairs and are now being referred to them for follow-ups.
What's the ultimate dream for Africa Health now? Probably another 10, 20 years. You know, how do you see this NGO growing?
The ideal is that African Health now is synonymous to the Red Cross, synonymous to Médecins Sans Frontières, that people know that we're here to help the community and we're much bigger than we are now. A larger volunteer pool, people that are connected worldwide, and definitely that we cross the borders of Ghana, able to go to our neighbors, Togo, Benin, Nigeria. The goal is to just get bigger and stronger and be able to make a stronger impact in the lives of our African brothers and sisters.
Well, Kathieka, thank you so much.
Thank you.
It's been wonderful. As I said, today we're talking to wonderful Ghanaians who are doing, in their own small way, huge things that impact the larger society. Our next guest is also doing something similar, but they are in the education field. Stay tuned and don't move. Thank you. Well, thank you very much for staying. And as I said today, it's different. What are we doing? We're talking to Ghanaians who, in their small way, are doing big things. And now we spoke to Kathieka, who was doing something to do with health, helping communities in deprived areas. Well, we have now Nana Evans, who has an NGO called Amazak. They are into education. We want to find out what it's all about. Alma, thank you and welcome.
Thank you for having me.
Great. Alma, so you were a teacher?
Yes, I am.
Now, you're not a teacher in Ghana, so tell me about it.
No, I'm a teacher in New York City. I'm currently teaching kindergarten.
Okay.
I teach in what's called an ICT class, which means we have children with varying abilities. We also have children with special needs in this class that are mixed with children who don't have special needs.
How do you do that?
It's very easy. We modify our lessons, and so my motto as a teacher is, if your lesson doesn't go well, don't blame the student. You as a teacher have to reflect, go back and see where you could have made that instruction a little more clear. And so what we do is, everyone gets taught the same thing, we just modify the products for each student.
Aren't you either slowing one down or pushing one too much?
Yes, I mean, we meet the children where they are.
That's interesting. So you don't separate and look, you go to special school and you...
No, not at all. We believe that every child has the ability to learn. And so with that being said, we are educating the whole child. We're educating the whole child in an environment that's conducive to their learning style. And so if you are lagging behind and you can't write, then you can draw your expression, or you can verbally tell me your expression. Children have lots of different needs, and we also believe that each child has a unique learning style, and so we try to curtail our teaching to fit the child's learning style.
See, I grew up with dyslexia, so I wasn't the faster one in class.
You would be in my class.
You see, and my teachers back then didn't understand that, let me help this kid a bit more. It was like, oh no, you are too slow, go into the naughty corner. So that's no more.
Yeah, we work with parents as well, because we believe that parents need to be involved in their children's education. And so in a situation as yours, we would consult with your parents, see what your learning style is, tap into your interests, and go through it that way.
Wow. How long have you been teaching?
I've been teaching for about 10 years now.
Love it?
I love it. It's my passion.
But you mean kindergarten? I mean, kindergarten.
Well,
Are you a patient person?
Patience for children. That's my disclaimer.
Okay.
Yes.
Because otherwise
it's not easy, but it's very rewarding. It's extremely rewarding, and it's my passion. I live to teach. I'm constantly learning, which is a part of my job, which I love. And so it feels effortless.
How did you find time and where did Alma's Arc come about?
So Alma's Arc actually came out very accidental. I have two children. I have two sons, Carter and Chase. They're 7 and 9 years old. And I found myself decluttering my environment. I had an excess of books, clothes, just stuff in my apartment. And so I decided to start clearing things out, and I went into their bedroom. They had lots of books and educational toys that they had outgrown. Someone who's very close to me, Mine Donko, has a school in Agona. And so I decided to give her the books. This conversation led to a bigger conversation. I've had a very huge desire to come back to Ghana and teach. And so I've been contacting my family and friends, trying to find out if anybody could kind of, get me into the door. After my conversation with Mine, I was inspired to start Alma's Arc. I realized living in the US, we have excess. And so for every 5 pencils we have, a student in Ghana has half a pencil. And so with that thought, I just started contacting my friends, neighbors, my fellow teachers, and requesting any materials that they weren't using. This turned into a movement. It started a book drive, and 20 barrels later, I was in Ghana delivering my resources to initially the Mine School for Hope, but we had such an abundance of resources, we were able to share them among 7 schools in rural areas in Ghana.
Which Edumasa is bad.
Yes, and that's, yes, Edumasa. And I also was able to establish a relationship with Isaac, the headmaster at Edumasa. And so part of the service that we offer is also teacher mentorship. Without good teachers, there's no good students.
I think that's where the difference is. So it's not like just dumping the books and going away.
Yes, so initially it started off as just, okay, I'm going to give these books out, and whenever I get more books, I'll give them out. However, when I went to the schools, established a relationship with the students and the teachers, I realized that I could be more effective in terms of knowledge and sharing of ideas with teachers. And so we decided to sort of initiate professional development. I'm not coming in and saying that I am better or that I know more, but it's an exchange of ideas. And that's what I've been able to establish with the teachers here in Ghana, and I'm very grateful for that.
Does your ideas conflict with our culture here, or it doesn't matter? Does it fit in?
That's an interesting question. I would say that somewhat. In regards to my attitude towards education, you mentioned saying that, you grew up dyslexic and all of your teachers thought that you were misbehaving. And so I find that here in Ghana, the focus is more so on discipline and not necessarily having fun at school. We want our students to want to come to school, for school to be an enjoyable, fun place. And so the emphasis more so when I work with these teachers is how to make their lessons more interesting for the children. It's easy to introduce a child to, let's say, a subject like architecture if you're using blocks. It seems like a very lofty idea, but even the work I'm doing with Isaacs, we're teaching kindergartners how to be career-minded even at 5 years old. And these concepts may seem beyond them, but the resources and I'm more so the mindset of the teacher is what is going to curtail the outcome.
So far, you impressed, or are you disappointed where you come back and you think, oh, look at what they're doing to the books, or so,
so far, I will say that we've received so much love. It is a very powerful feeling when we went to Edumasa to have all this positive energy around me. And I realize that I have a lot of work to do in terms of organizing. There's a lack of infrastructure and just organization. And so I'm not disappointed at all. I'm just eager to help.
And then there's P527?
Yes, PS527 is where I work.
PS527. Yes. And the school now supports you too?
Yes. So we are the Eastside School for Social Action, and part of Alma's Arc's mission, our mission statement is to educate and empower youth through social action projects. And what we mean is that we involve the children in their own destiny. This is not just a project where we contact teachers. The students at PS 527 are very involved in the collection and the donating of items. And so we're using this as a way to bridge cultures. And so we have students in New York City that are not communicating with students here in Ghana. And they're working on projects. We have one project with Grades of Green, which is an environmental nonprofit organization that's working on a water challenge with our students here in Ghana, as well as our students here, in the United States. And that project has given them the opportunity to communicate.
The teachers, are they accepting the changes coming, or for some, look at all this, we have to whip them, then you come in to say show love?
They are very, very, very appreciative. What I have noticed, however, is in Ghana, teaching is not a profession that's respected. You know, you have to say, I'm a lawyer or a doctor or an accountant. And I think that mentality needs to switch. Without a teacher, there is no lawyer, there is no astronaut. And so I feel like we need to invest in our teachers. There's a very high teacher turnover. I visited a school one term, come back the next term, the teacher's gone. And so without investing in the teachers, it's like having a bad foundation or a bad foreman for your construction site. You need someone who's going to be able to facilitate instruction, who's passionate and who's buying into it. The children are already bought into their education. They're vested. They want to grow up and be able to take care of their families, be productive citizens. And that's part of Alma's ARC's mission, to instill them with sustainability skills so that there isn't a huge desire to leave Ghana. We want them to stay in Ghana and build up the country.
Now, you want to come, so what would you do? Would you be like a teaching ambassador hopping from school to school, or you just want to set up on your own? And
for now, I like the consultantship because I'm learning a lot. I didn't go to elementary school here in Ghana. Okay. I went to secondary school here, and when I was in secondary school, the system was different. And so I'm learning a lot. I'm not coming in thinking that I know everything. I'm here to learn and see how we can fix issues.
No, but when you come, because you want to come down.
Yes, yes.
Yeah. Would you want to be like a visiting kindergarten teacher?
Well, I've taught from kindergarten up until 12th grade, so I can teach anything from K up until secondary school. For now, eventually, we would like to build an Alma's ARC Resource Center, and we're working towards that. And that is just something that we feel every district should have a central location where people from 8 to 80 can come and be educated. For now, I don't mind hopping from school to school, but eventually I would love to live in Ghana and build my own school.
How involved is
PS 527?
PS 527, which is a school. It sounds like
yes.
a lottery number, but that's a school in Manhattan, PS 527.
Yes.
How involved are they, and and how are they going to, until which point are they going to?
So PS 527 is very invested in building global citizens. And so the fact that they've been able to establish contacts with educators here in Ghana, they're thrilled about the idea. They've been involved in 2 of our donations, so we are very grateful to them. And they're looking forward to coming to Ghana. I'm actually have plans of bringing 2 teachers here during the summertime to explore our options and where we could be most useful.
Has the, probably not gone that far, but the ministry been involved in any way?
We're getting there. I have some friends at the Ministry of Education, and so we're working towards, we want to be able to build our reputation, build our good works, and then go to the ministry and say, this is what we've done on our own. Please support our efforts.
Now, at the moment, one thing that's lacking, it's computers.
Yes.
So we get the books, but the computers. I mean, once you leave Accra, it becomes almost like a dinosaur. I mean, it's along your...
It is definitely part of our mission. Technology bridges the gap. At this point, you're saying computers, but we've even brought it down to phones. Whatever research that you need to do can be done on a phone. And so we are planning a Gadgets for Ghana event where we are collecting any type of gadget that can get online so that we can give them to our teachers, to our students. Technology, putting books in people's hands is awesome. However, the wave of the world is you can have 1,000 books in one device. And so we are also working with an organization that's here in Ghana called World Readers. And World Readers is a nonprofit organization that supplies schools with e-readers. So you can load 100 textbooks onto an e-reader, give it to a child, and it's paperless. And so that's definitely the direction that we're going into. Jamal Bowman, who's the principal of Casa Middle School, happens to be a very good friend of ours. He's looking into donating computers to Alma's Ark so that we will be able to give them to our schools here in Ghana.
So hold on, I want to take a break and come back, and then I find out how would they identify that, yeah, this guy needs more computers than this guy.
Oh,
Stay tuned, we're coming back. Well, thank you very much for staying, and I guess you're getting inspired, and in your own small corner, you've identified a challenge that you think you can fill the void, and then it always starts that small, from 1 barrel, 2 barrels, God knows how many barrels it ends up in. But with computers, in fact, before I even get to computers, I mean, there's so much, and there's so much that you can do. So, I mean, how do you then decide, well, I'm going to help them, but look, you guys can wait? It must be.
My boss, Dan McCormick, who's the principal of PS 527, has taught me a lot. And one thing that I learned from him is fair means everybody gets what they need and not necessarily what they want. And so in our vetting of the schools, we will assess the needs. One thing that we are very concerned about in getting computers is internet access. So we are working with a lot of schools in rural areas, and what we've realized is you can collect things, and people are very generous, and you'll get the stuff. However, you can get to a school and they won't have an outlet to plug in the computers. And so based on the readiness of the school is how we'll determine what resources are allocated.
I gotta make sure I have outlets.
Please do. And honestly, that is something that I feel the Ministry of Education should take on board. Every school should be given free internet access. It's part of their education. It's instrumental in them catching up. If Ghana wants to be able to compete in regards to being on the world stage, we have to catch our students up to the rest of the world. Ghanaian students abroad are excelling. You can turn on the TV or go on the internet and see a Ghanaian child that lives abroad has gotten a scholarship to major Ivy League schools in the United States. And you ask yourself, why is that? It's only because that kid has access to resources that our kids don't. Our kids here in Ghana are equally as capable. We just want to bridge the gap and be able to give them the tools they need.
You being a teacher, I mean, you've been into classrooms here, you've been to classrooms in America. How disadvantaged are kids in a classroom here?
The kids here just lack basic necessities. Water at school, food at school, uniforms. And not all the schools. I'm talking of the schools that I'm working with in the rural areas. But they're happy to be there. They're excited to be at school. And so we just want to make it a fun, happy place for them. How disadvantaged? I can't quantify that without feeling like I'm demeaning them to an extent. And so I just feel that with the adequate resources, they'll be able to do what they need to do. They're already doing it. I just want them to be happy doing it and to be able to do it the way their counterparts in the United States are.
Do you think we should change teacher training and teacher attitude from the more leaning towards the discipline to the fun? Because I think that's the culture. So they come out knowing that, look, I have to be holding a cane and I have to be firm. And
I think that starts with your teacher programs. I think that if you're happy to come to work, I don't feel any apprehension going to work in the morning because I know that I'm going to a place where I'm respected, I'm appreciated, and I feel that that's what needs to happen. Again, teachers need to feel appreciated. They need to feel like what they're doing is important. They need to feel that they have an impact. They are changing lives. We all have teachers that we remember. We can all single out one teacher that performed maybe an ordinary deed that wound up having an extraordinary impact in our lives. And so that's where I feel that they really need to invest in, is making teachers want to stay at the job and feeling respected at their job.
I mean, you said something that you wanted Alma's Arc to be represented in every district, 8 to 80?
Yes, eventually.
Eventually?
Yes.
So like a little community center that...
Yes, like that's exactly what it is, a community center where we have sort of like a library but more. So you have educational programs. In my hometown of Intinanko, my mom is the Queen Mother. And she started off, once she became the Queen Mother, she started off donating
What's
things.
her name?
Oh, Nanam Pofwa.
Nanam Pofwa.
Hi, Mommy.
HL.
Yes, so she's really been instrumental in this in regards to inspiring me and teaching me to give back to my community. She unfortunately was injured and couldn't continue her work. And so I've kind of picked up the mantle and I'm continuing my mom's vision. Eventually, we'd love to have Alma's Arc, not love to, we will have Alma's Arc resource centers in each district, and it'll serve as a center, a community center where we'll have after-school programs, we'll have adult education, computers, anything that will enrich the community and make the people feel like there's people who care about them and want them to be productive citizens.
I spoke to Kathy. Kathy is with African Health Now.
Yes.
Yeah. Now, she was saying that sometimes there are more challenges with getting like young people to just say, look, I'm offering my services. I don't know if you have any challenges like with Alma's Arc. Do you get people to say, oh, look, I don't mind going there to distribute the books for you? Or
Alma's Arc is very young.
Okay.
We are not even a year old at this point.
Okay.
And so I've been relying on my friends and family. Everybody's very eager to help. I haven't had those road bumps. I have just had to deal with logistics. For instance, we ship barrels through the ports, and we've had difficulties getting the barrels from the port, transporting the barrels. Our operations manager, Akwesi Kobnas, has been handling that, so I've been very fortunate to have people on the grounds who are helping me. But, there's little things. Like I said, we could get to a place, there's no internet, there's no light. That sort of thing. But I haven't received much pushback. I will say, in talking to people about our mission, people will say, oh, I tried that, and they just put the books in the classroom and didn't do anything with it. And I feel like as an educator, that's where Alma's Arc is different. We're educators, so we're not just going to give you the books. We're going in there and we're helping you catalog them and categorize them. And not only that, we're making sure that you have bookshelves. You asked me this earlier. Yes, I did a donation at a school, came back a few months later, my books were still in a barrel. And that broke my heart. And then instead of being upset, I realized, no, I have to help them display the books so that the kids can see them. So I'm more solution-minded. When I do encounter a road bump, I figure out how to get over it instead of complaining about it.
I also realized that you give a lot of like teaching aids.
Yes.
Is it deliberate?
It is very deliberate. We want to invest in the teachers. We've given away 7 iPads. PS527 donated some iPads, as well as some of our friends and family donated iPads as well. And so every teacher that I communicate with, I give an iPad to, along with teacher manuals to help guide their practice.
Is it in conflict with what the GES wants them to do? Because I brought Jollyphonics to Edumasa, so I had to write to GES to say, listen, the teachers are not going to follow your model anymore. Well, they agreed that if you train the supervisor, then you can do it, so that when the supervisor comes around, he understands. I don't know, with what you guys do, is it in conflict with what we do? Or?
So far, I have to say I'm not sure because I haven't asked. I've just been doing. And until, I get to a point where somebody stops me, I would love to comply if I, know the rules. But until then, we'll break the rules until we know them.
But so far, it's going well.
So far, it's going very well.
Great. What the feedback you get from teachers here?
Just appreciation. They're very humbled. We're humbled, humbled and appreciative. That is, that I feel as if they feel like finally somebody is looking at me. Somebody is acknowledging my work. Somebody wants to offer a helping hand and not a criticism, It is easy to disguise a critique as a compliment if you do it the right way.
I see. And how many schools so far?
7 so far.
It's not bad within a short period. And are you maintaining the 7 or you?
We're maintaining the 7. Hopefully we get on to 8, 9, and 10. So far the 7's been manageable, but we're maintaining the 7 for now. And if there's any schools out there in rural areas that are in need of academic resources, you can visit our page at almasarc.org, contact us, and we would love to help you.
But you see, one thing I realize that you keep going back to the schools that you donate to.
Yes.
Because normal NGOs will drop. Thank you very much. I'm off. But you sort of like are adopting.
Sort of, yes.
Yeah, the schools as you're going along. Is it not too much of a burden?
So far, I feel limitless. Until I feel that I'm extending myself and I'm not being productive, I won't, limit our possibilities. But so far, with my team, I don't work alone. I am the face of Alma's Arc, but by no means do I work alone. I have a team of educators, as well as trained professionals to help us. And so, we'll do the best that we can. But having access to the internet has made it so that we can have Google Classrooms. And so I can communicate with all of my teachers at once via the Google Classroom.
That's smart.
I try to work smart and not hard.
That's really smart. So what, like lessons for today is this and then?
Yes, so we plan units. For, as teachers, we plan months in advance. I plan what I'm going to teach a whole year in advance. And I draw up what's called a curriculum map. And so based on what the school tells me, I try to work on their curriculum map with them. And so that's what I've been doing with Isaac. So Isaac has given me their kindergarten curriculum, all of the standards that need to be hit. I look at that, and through the Google Classroom, give him ideas and resources to facilitate those lessons.
Wow.
So technology makes a big difference.
I know. That's not as easy as we think. Whether the teacher turns up in the classroom and says, yes, pick up your pens, it's A, B, C, D.
There's more to it than that. There's more to it.
Are you going to have any exchange programs?
Yes. Well, that's why our first exchange programs is bringing teachers here. So this July, as I mentioned before, I'm bringing 2 teachers. Eventually, we would love to have students at PS 527 visit. My school actually has an annual benefit where they raise a lot of money. And at this auction, I will be auctioning a trip off to Ghana to bring a family over, which consists of some students. We'd also like it to work the reverse way. We've established through Alma's Arc a STAR student program where we single students out who are really doing well. We try to encourage them by giving them positive reinforcement. And so eventually we hope to single one of these STAR students out and have them visit the United States to see how we live over there as well.
That'll be smart. I think whichever students that wins, that will be over the moon.
Yeah, so hopefully, competition breeds excellence. And so having them compete academically for the STAR student honor, I believe will invigorate them and really want them to strive to do their best.
Just wanted to find out if, because you are like a kindergarten teacher, is Alma's Arc, focusing more on the kindergarten side, or are you spreading all the way to P6? Or?
Since I specialize at this point in my career in early childhood education, and we believe that a great foundation leads to further, growth as a student, I am focusing on early childhood.
Okay.
We have junior high school teachers on our team as well. So we will distribute the work according to where everybody specializes. But we don't have a limit, no, not at all.
So far as things go?
So far as things, yes, from kindergarten all the way up to 12th grade.
Okay. Well, I say that's impressive, and may I ask, how soon are you going to come home?
Hopefully I'll be back in July.
Okay.
Yes.
No, I'm talking about permanent.
Permanently, ooh. Well, I love my job at PS 527. And so at this point, I feel like I'll just go back and forth. Whenever I have a free moment. I'm back in Ghana. I'm sure when I get to the airport, they're like, why is this girl coming here so much? But I would like to divide my time for now.
Okay. Well, we wish you all the best.
Thank you.
And we say thank you, we encourage you, and probably somebody watching would... do you need any volunteers at the moment, or are you okay?
We are always interested in volunteers or any ideas that you have. Again, you can contact us on our webpage at almasarc.org. Just hit contact us and the info button, and we'll respond accordingly.
Well, so that was a bit different. As I said, today we were just speaking to Ghanaians who in their small way are doing big things, but normally you never hear of them. I think today we'll put the cameras on them, and that's exactly what we did. Thank you very much for watching, and I always give you this number, 024-366-2001, 024-366-2001. Tanti's Fashions, they make the shirts for the show, so give them a call. But once again, Alma, thank you so much.
Thank you, Nana.
And well done. We'll be back to do this all over again.